good morning, good afternoon, and good evening, everyone. Thank you for joining. On behalf of the International Federation on Aging, we welcome you to today's interactive dialogue on the integration of life course approach to immunizations within NITAGs. The International Federation of Aging strives to be a global point of connection and a network of experts and expertise to influence and shape age-related policies. Working towards this goal, myself and Ms. Katrina Buzanis of the IFA are joined by experts to discuss the findings of the IFA's recent study on a review of the National Immunization Technical Advisory Groups, or NITAGs for short. Today's session will open with a scene-setting presentation on the WHO's NITAGs program and the development of the NITAG Resource Center to support and build their capacity. We will then move on to an overview of the IFA study. Next, there will be a translation of evidence through a moderated panel discussion with Dr. Michael Moore, Dr. Matthew Tinnis, and Dr. Omar Sultan. From this discussion, we hope to garner key recommendations that reflect the evidence to action principles of practice to strengthen the role of NITAGs. I would like to now welcome Ms. Hanoff, Technical Officer at the World Health Organization. Ms. Hanoff joined the Agenda Policy and Strategy Unit in 2017. She acts as the Executive Secretary of the Global NITAG Network, organizes biannual meetings and webinars to foster experience sharing among NITAGs. She oversees all NITAG strengthening activities in collaboration with global partners and WHO regional offices. Now, without further delay, I would like to hand the floor over to Ms. Hanoff.
Thank you, and I will just share my screen. I was requested to provide a brief overview of the work that we do at WHO to support NITAGs. And just a reminder that the NITAGs were really integrated into the Global Vaccine Action Plan that ended in 2020. And now with the Immunization Agenda 2030, the work of NITAG touches all of the 7 strategic priorities, and in particular, commitment and demand. And they underpin all core principles, and in particular, the country-owned principle that all programs should all countries should establish targets that are shaped by local context, and that they should really own their achievements. So at WHO, we encourage the dialogue between SAGE, which is the to WHO. Then at the regional level, there are the NITAGs that provide recommendations and adapt the SAGE recommendations to the regional context, and they provide recommendations to the WHO regional offices. And then you have the NITAGs. And what we're trying to do is really foster the links and the dialogue between the 3 levels. And the one that we concentrate all our efforts on are on SAGE and NITAGs, and making sure that NITAGs can participate and observe the SAGE meetings, that they understand the recommendations, and that they are able to adapt them at their local context. To monitor the progress of NITAGs worldwide, we have come up with process indicators that are included in the GRF, and they are annually monitored. The 6 indicators are really process-oriented, and you could tick all the boxes, but still have not a very well-functioning NITAG, let's say. So we developed 2 additional indicators in 2021 that are NITAGs should issue at least 1 recommendation, and a recommendation should have been adopted by the Ministry of Health the previous year. So these are 2 new indicators. We don't have data for the years before 2021. And so at this date, we only have the data for 1 year. So we don't have enough hindsight to make any comment on the indicators yet. But what we can comment on are the 6 indicators that I've just shown, that are process indicators. What you realize now is that the numbers of NITAGs, the numbers of countries with a functional NITAG have reached a peak in 2020. So it shows that the efforts have really proved useful to establish NITAGs in all countries, or making sure that countries have at least access to a NITAG. The functionality of NITAGs, though, is stagnating a bit, and you see we've reached a number of 123 countries that have a NITAGs fully functional as per the 6 criteria that I shown just before. And the reason why it's stagnating is, of course, there was the pandemic, but also there are additional resources needed to make the NITAGs functioning, and sustaining these resources are difficult sometimes for countries. And the 2 regions where we have more efforts to do are the repro region, where you see there are countries with no NITAGs, and that's because there are a number of very small countries. So we are exploring at the moment the idea of having a sub-regional NITAG for all the small countries where the expertise would be limited. And the Afro region, where you still have countries with no NITAG, or NITAGs that are not functional. And for that, a NITAG support hub has been established and is based at the University of Cape Town. And the hub is really supporting WHO Afro to increase the efforts on establishing and strengthening the NITAGs. So at WHO, what we are doing is, again, with the idea that it is a 3-level organization: global, regional, national. At the global level, we offer high-quality resources, and it was mentioned before, the NITAG Resource Center website is maintained at WHO. We also develop guidelines and training materials and make them available on the platform. We foster the networking through the GNN. We organize GNN webinars and SAGE Digest, again, with the idea to increase the dialogue between SAGE and NITAGs. And we invite NITAGs to participate in the SAGE meetings. And then we provide support to the regional offices. The regional offices organize trainings, either on establishment of the NITAG, on strengthening the secretariat, and in particular on the ETR process using a specific policy question. They bring up to speed new members because the NITAGs are requested to rotate. They also build up regional networks and make sure that experience sharing between countries speaking the same language is possible. And then at national level, the WHO office supports the evidence gathering, the clarification of global recommendations, and support the NITAG evaluations to go beyond the 6 criteria that I've mentioned. So this is just to capture a screenshot of the platform that we have, the NITAG Resource Center. This is the one-stop shop for all NITAG documentation. So documentation issued by the NITAGs or guidelines issued for NITAGs. This is also where you will find the map of NITAGs and information on all the different committees. You would also find information on the trainings. So all the training materials are made available there. And you would find information on the GNN and partnership that we have, especially with the Robert Koch Institute, where we have developed a repository of systematic reviews that are quality appraised by the Robert Koch Institute. And then finally, the Global NITAG Network. This is an initiative that was set up in 2017. And WHO is the executive secretariat, but we have a strong GNN steering committee that is helping us in rolling out the work plan of the GNN and organizing the webinars and the annual meeting. And so the next meeting will be in June 14th to 16th in Amman, and that will be in hybrid format. So remote participation is allowed. Apart from that, the idea of the GNN is really to foster exchanges through webinars, through monthly updates, through surveys. We liaise with regional NITAG networks where they exist, and we provide support in building up those regional networks. Then we participate in revision and development of any guidelines and guidance developed for NITAGs. And so the GNN Steering Committee is tasked to review those materials developed for NITAGs to make sure that they are really fit for purpose. And then we try to document as much as possible the experiences and the best practices of NITAGs. And I think this is my last slide is on NITAG partners, because we couldn't be doing all of the work that I mentioned without the strong support of partners to develop generic tools. And just to flag that we have recently developed the NITAG maturity assessment tool, which is an evaluation tool to go beyond the 6 criteria and to identify quickly the areas for improvement, the ETR training materials, the systematic review registry that I mentioned. Partners also do provide on-site and online support for workshops and for webinars, and they are invited to participate in quarterly teleconferences and provide feedback on global activities. So I just want here to acknowledge the work and the support that we receive from partners. And the next step is really to develop new partnerships to reflect current decision-making challenges and sustain the partnerships that we have. And that's it, and I thank you.
Thank you, Ms. Henoff, for providing such an informative overview of the important work of NITAGs and really highlighting some of the key gaps in the coverage of functional NITAGs globally. I believe this presentation has really broadened our understanding of NITAG capacities and capabilities in relation to supporting national immunization policies and strategies. So, as mentioned by Ms. Henoff, NITAGs are multidisciplinary country-level expert committees responsible for providing independent evidence-based advice to policymakers and program managers on immunization and vaccine policy. The IFA study called Evidence to Action, a review of national immunization technical advisor groups, was conducted to perform a high-level review of NITAGs to better understand the progress, rigor, transparency, accountability, and composition of experts in line with the life course approach to immunization. So just a brief overview of this presentation, we will start off by discussing the life course approach to healthy aging, which will help us to identify the problems within NITAGs. Next, we will dive into the methodology for this body of work and how the United Nations Immunization Agenda 2030 guided the objectives and purpose of this research. Finally, we will conclude with key study findings and recommendations. To provide some context to the problem identification, it is important to recognize that population aging is a rapid global phenomenon that has profound implications for all aspects of health and well-being and health system development. By 2030, about 1 in 6 people, or 4.1 billion people, will be aged 60 years or over. Given the significant shift in age distributions globally, there is an urgent need for increased efforts to support healthy aging populations, especially in low to middle income countries who will experience the greatest challenges. Parallel to population aging is the risk of non-communicable diseases and chronic conditions increasing dramatically. NCDs are responsible for 41 million deaths per year. With the anticipated rise of aging populations and the complex relationship between non-communicable diseases and vaccine-preventable diseases, which innately increase morbidity and mortality rates among older adults, there is an unprecedented demand for the implementation of a comprehensive life course approach to immunization. As we know, vaccination is a significant driver in advancing life expectancy by reducing deaths. As described by the United Nations, the decade of healthy aging, a life course approach recognizes the progress of developing and maintaining the functional ability that enables the well-being in older age, which is impacted by the interactions between individuals and their environments. The World Health Organization Immunization Agenda 2030, or IA 2030 for short, was created with the intention to align and inspire global stakeholders in immunization to maximize health in all stages of life and progress towards the Sustainable Development Goals. The strategic framework for action outlines objectives for country-level technical bodies to be responsible for developing coordinated national immunization strategies to achieve aligned contributions to the IA 2030 targets. NITAGs are to leverage guidance from the strategic advisor groups of experts on immunization to shift the priorities of their respective ministries of health. Strategic priority number 4 in particular of the IA 2030 outlines the goal of all people benefiting from recommended immunizations throughout life by strengthening policies and establishing effective public health interventions for target groups. Therefore, the achievement of a healthy global aging throughout the life course advances the critical need for NITAG groups to enhance their transparency and representation of their members in line with a life course approach. Since the launch of the NITAGs, there appears to be a lack of information and referred literature on their governance, management, and impact. A previous study conducted in 2018 reviewed the implementation of NITAGs in 6 countries. This study brought about questions in terms of the transparency, the accountability, the level of authority, and the degree to which the composition of membership represents a life course approach to immunization and therein supports healthy aging. Today, national immunization plans largely focus on reducing mortality and morbidity in children, although the significant burden of vaccine-preventable diseases lies with older adults. Therefore, it is imperative for NITAGs to include expertise which consider immunization policies to support older adults. The main objective of this study was to help influence and shape a high-level review of NITAGs, including but not limited to the representation of its membership in line with the life course approach and the integration of the IA 2030 agenda. Firstly, a comprehensive review of 34 NITAGs across all WHO regions was conducted to examine publicly accessible information. Such data was collected on government websites, such as the Ministry of Health web pages, press releases, and peer-reviewed articles. For each country, demographic data was collected, which described the country-level income, gross domestic product, and population aging distribution, and the prevalence of non-communicable diseases. The rationale for the selected countries was to ensure a representative sample for a comprehensive review by accounting for the fact that population aging varies across regions. Next, the information was systematically organized to assess the composition, mechanisms for operation, nomination and selection processes, missions and responsibilities, and the processes in place for grading recommendations. Each NITAG was also assessed on the degree to which they meet the 6 WHO process indicators. When all 6 process indicators are met, a NITAG is deemed to be functional, and these indicators help to ensure a comparable and systematic monitoring of the NITAG's processes. Finally, the findings were viewed through the lens of the TAPIC governance framework. This framework was developed by the European Observatory on Health Systems and Policies, and it incorporates the attributes of good governance, transparency, accountability, participation, integrity, and policy-making capacity. The evaluation of these 5 domains of the TAPIC framework helped to align the gaps with the adoption and implementation of NITAG recommendations. The key findings were organized and analyzed according to the 5 domains of the TAPIC framework. In terms of transparency with respect to NITAG recommendations, 32% of the NITAGs selected had recommendations accessible on government websites. NITAG working documents are not always available in the public domain. Just less than 32% of the countries had their meeting minutes and meeting agenda available online. Furthermore, South Africa, Zambia, Qatar, Lebanon, Japan, Chile, Bolivia, El Salvador, France, and Italy did not have information on processes to develop and grade evidence-based recommendations online. In regards to accountability, only 56% of the countries had policies and processes in place to manage conflicts of interest for all its members and working groups. Conflict of interest policies involved members signing a written declaration of confidentiality. In Thailand, for example, there were no such formal rules for conflict of interest among the nominees for membership and the members. In such cases, the Thailand NITAG made a judgment on whether a nominee's relationship with the company is significant enough to bias their views and affect their partiality. In terms of participation, about half the countries publicly noted that meetings included external experts such as consultants from the WHO, industry experts, and specialists. Furthermore, NITAGs did not include external participants such as civil society organizations and community advocates in deliberations. The mission of NITAGs is to develop independent evidence-based recommendations to governments to facilitate policy-making processes. In terms of integrity, 60% of the country NITAGs did not circulate the agenda and background documents at least 1 week prior to the meeting. Furthermore, more than 26% of the countries did not have clearly defined terms of references. It's important to note that the circulation of the agenda and background documents and a defined terms of reference are included in the 6 WHO process indicators. Finally, in terms of capacity, NITAGs provide scientific basis for decisions on population-based immunization programs. NITAG members had professionals with a wide range of diverse skills and varying expertise in different disciplines. About 86% of the countries studied had pediatricians highly represented among their core and associate members. In Honduras, for example, all 7 members were pediatricians. However, only 3 out of the 34 countries studied had an expert in adult vaccination and geriatrics. In France, there was a geriatrician among the core members. In El Salvador, there was a representative of the Salvadorian Association of Geriatrics, and in Canada, there is a geriatric specialist among the 16 recruited members. It is important to note that the WHO process indicators are a crude measurement of the performance of NITAGs and can arguably be used to evaluate the evidence-based processes to inform immunization-related policies. From our findings, it is conclusive that there is little to no data indicating membership of experts in the field of healthy aging. The study was not conducted to determine the overall performance and development of NITAGs, but rather to use the available data to understand the degree of development in line with the life course approach to immunization. Although the 6 WHO process indicators serve as an effective tool to assess NITAGs, they do not evaluate the performance and effectiveness of NITAG's contribution to shaping age-related immunization policies and programs. While other indicators assess legitimacy and independence of NITAGs, the indicator, which requires at least 5 areas of expertise among the core members, does not specify the types of members. There would be value in stronger recommendations on the composition of NITAGs that represent a life course approach to immunization. The findings from this study demonstrate gaps in the transparency, governance, and functions of NITAGs, and most importantly, the degree to which the composition of membership represents a life course approach to immunization and therein supports healthy aging. To achieve immunization targets set out by the IA 2030 Framework for Action and the recommendations of the UN Decade of Healthy Aging, there are several strategies to be considered to meet the needs of the global aging population. 1, a call upon the WHO to recommend that at least one of the 5 members of the NITAG has an expertise in a life course approach to immunization. 2, to call upon member states to improve the availability of public information of NITAGs. 3, to call upon member states to mandate reporting of all conflicts of interest of potential and current NITAG members. And finally, to call upon member states to recognize the importance of independence and autonomy of NITAGs in assessing and reviewing data and deliberating on decisions that inform government immunization policies and implementation. In response to the current demographic trends, there's an urgent need to support the health and well-being of the rapidly aging global population. The gaps in adult vaccination policies and programs in a life course approach means that older people are being left behind and their lives and livelihoods are compromised. NITAGs have the responsibility to frame their deliberations through a population health lens and help drive forward the National Immunization Plan in the context of the IA 2030 Agenda and healthy aging. This calls for purposeful action to include experts and NITAGs across all stages of life, including older adults, to serve as a strategy to prevent disease and therein support healthy aging more broadly. Lessons learned from each country and overarching recommendations derived from this comprehensive study aim to inform guidance in promoting and strengthening practices that improve the effectiveness of NITAGs. Thank you everyone for listening, and I now open the floor to any questions that may be posed in the chat or orally. Dr. Barrett?
Yeah, look, thanks, Sharon, and thank you very much for a really important presentation on this study. I think my question goes back to one of your recommendations. You're recommending that 1 out of the 5 NITAG representatives have an expertise in life course approach to immunisation. Could I ask you whether you're actually hoping that that expert has some experience or expertise in adult immunisation? Is that what you're hoping for, while also reflecting the importance of a life course approach?
Yep. In our research, using the example of El Salvador, France, and Canada, I think there would be a high value in having a representative with an expertise in geriatrics and gynecology.
Sharon, can I come in?
Yep, Ms. Hanoff, go ahead.
Yes, this is not a question, but more a comment on one of your recommendations regarding conflict of interest. And just to share experience that among the 6 indicators, process indicators that we have, this is the most challenging one to improve. And although we've been orienting countries and developing guidelines on declaring interest and managing conflict of interest, this is still a challenge for most of the countries.
Thank you for sharing that, Ms. Henoff. Okay, so if there aren't any more questions, I will now hand the floor over to Ms. Katrina Buzanis to moderate the panel discussion.
Thank you, Sharon, and thank you so much to Ms. Louise Henoff for really nicely setting the scene and providing an overview of what NITAGs are, how they function, as well as to Sharon for speaking so nicely about the study that IFA has done. So that really nicely sets the scene for our panel discussion, and we have some really esteemed panelists today that I'm happy to introduce. So it's really exciting to have this level of expertise with us today. So I'd first like to introduce Dr. Omar Sultan. Dr. Sultan is a medical doctor who specializes in pediatrics, maternal and newborn health, infectious disease, and public health. And he has 27 years of UN expertise in maternal, newborn, child, and adolescent vaccination and vaccine delivery programs, leadership, and multi-sector partner coordination, including research, monitoring, and evaluation across Africa, the Middle East, Asia, the Indian Ocean, and Pacific Island countries. So Dr. Sultan also has 5 years of experience in NITAG coaching and technical advisory for various WHO and UNICEF regions. Next, we have Dr. Matthew Tunis. Dr. Tunis is the Executive Secretary to the Canadian National Advisory Committee on Immunization, where he provides scientific leadership and technical oversight to the Canadian NITAG. And last but not least, Dr. Michael Moore. So Dr. Moore is currently chair of the World Federation of Public Health Associations International Task Force on Immunization, as well as a number of other health networks. And he is the former CEO of the Public Health Association of Australia and is a past president of the World Federation of Public Health Associations. Dr. Moore is a distinguished fellow at the George Institute for Global Health and adjunct professor at the University of Canberra, and is a visiting professor at the University of Technology, Sydney. And Dr. Moore was also Australia's first independent minister who's appointed as Minister of Health and Community Care. So welcome to Dr. Moore, Dr. Tunis, Dr. Sultan. Really great to have you with us today. So I want to jump right into the questions about NITAGs, but first I think it's a little bit interesting to hear, particularly Dr. Tunis and Dr. Sultan, how you became involved with NITAG work, a little bit more about your background. So maybe I'll start with you, Dr. Tunis.
Sure. I'm a PhD immunologist, so vaccines are definitely a passion of mine. And I work at the Public Health Agency of Canada, where we provide secretariat support to NACI as a committee. And so that was my entry path into work with NITAGs, was really through my technical interest and background, and then merging in through the Public Health Agency.
Great, thank you so much. And Dr. Sultan, maybe you can share a little bit as well about how you became involved with NITAG work, and you're particularly involved, I know, in RITAG work as well.
Yeah, thank you very much. I used to be, I started my career with, after my general medical practice degree with infectious disease. Unfortunately, at that time, while I came from UK just for my first master's, I could not find any really real-time such a reliable laboratory in my country. So most of us, we were involved in teaching. So, and at the Ministry of Health of Tanzania, and Zanzibar, there was, as we have two separate ministries of health. There is a unit of training over there, which is definitely have inspired me in going into teaching, and that's how I was involved in the communicable disease prevention department, where there was where the API program was part of it. So When I came back from pediatrics training in UK, I was among the few people to be involved in teaching vaccinology programs, etc. And then when the NITAG programs were initiated in the African region, so I had the opportunity to be appointed by one of the WHO African region senior technical experts to coach some of the NITAG country frameworks like in Guinea Conakry and then Guinea-Bissau, Mali, etc. So we started this as a journey. We of course we had the indicators and all the framework of declaring the conflict of interest, etc. But it was a very difficult journey because the perceptions of the people in the ministries of health, especially in the expanded program of immunization, where it was more or less like it's a one single person decision. So there was no framework for having the involvement and the engagement of the civil society organization. There was no involvement of other even departments of the Ministry of Health. We for instance, the women and adolescent vaccine immunization were very poorly represented, and this is the reason why you can see even in many African countries still we are still lagging behind in terms of adolescent immunization, leave alone adult immunization. If it was not with the appraisal of the COVID-19 pandemic and the yellow fever outbreaks across Africa. So I catch the train while it was moving very slowly with very little legal frameworks. I remember that we had to make a makeshift of legal framework and administrative framework in Guinea Conakry, and it was very difficult and honestly, but with the help, because the country representative of the WHO, Professor George Kisebo, he was my colleague. We were part in the same African Association of Professors of Public Health and Infectious Disease. So it was very firm, and the minister of health of Guinea Conakry was a very visionary, and he had ultimately a very diversity of opinion with the expanded program of immunization. So this is how it was, but with more advocacy, we managed to set up the program across West African countries and slowly to the Central African countries.
Yeah, thank you, Dr. Schultz. I think it'll be really interesting, I think, as we dive a little bit deeper into kind of what Sharon has presented in the findings of this study, to have your specific perspectives on the region, because that's, there are kind of a particularly contextual things going on in that region that I think will be interesting to kind of dive into. But Dr. Moore, I also want to come to you just to share, you bring kind of a different perspective, a little bit more of an advocacy perspective. So I want to share, if you could tell us a little bit about kind of your role in advocating for adult immunization.
I think one of the things in reading through your preliminary report, and particularly your findings around TAPAC, the good governance, transparency, accountability, participation, integrity, capacity. Why though do we need those? I kept asking myself, and then of course the answer lies around credibility. And we learnt this through COVID, that whilst decisions about vaccination are credible, we get extraordinary positive reaction and support, apart from a tiny group who will always oppose things in terms of immunisation. But when we look at the hesitant people, the next percentage, the 15 varies 15% of people who question, and that's a healthy thing really to be questioning, but where you've got credibility, then those questions can be answered appropriately. And so for me, when I do advocacy work, one of the fundamentals in attempting to influence government is to make sure we've got the policies, to make sure we've got the evidence, and to seek to influence on those fundamental basics. Of course, you still have to build good relationships and to make sure that you remain persistent. But within this context, I think that's incredibly important. And I think the other thing for me that has been really enlightening has been to watch the how effective the HPV vaccine has been for adults in Australia. And now we're actually talking about a time where there will be no cervical cancer. And it's an extraordinary breakthrough, and it has worked because of a commitment to an adult vaccination. And so when we talk about the life course, we have to retain our pediatric vaccination, but right through the teenage, right through the middle years, and I mean, we've all had probably tetanus vaccination many times, depending what we do, but then right through to senior adults, retirees such as myself, and what we do at that point. So that's really the important part for me. I suppose just to really nail that down is we also need to look specifically at country level NITAGs and the World Health Assembly. Remember, it's the World Health Assembly that guides the World Health Organization, not the other way around. And it's a great opportunity for us to seek to influence a general movement across countries, and that's a role for a civil society.
Yeah, thank you so much. And I think that's why IFA has conducted this work, is to have that voice and bring forward that voice of civil society. And I think that we'll kind of get to that a little bit later in the conversation, is how exactly civil society can be more engaged in some of these topics. But I do next, I want to go to Dr. Tunis just to get your thoughts on the topic framework that Sharon has presented and the results and how they align with that framework, and also how that evidence can be used to align the principles and practices of NITAGs.
Yeah, thanks. I think the report findings are interesting, and they are coming at a really relevant time. I mean, if there was ever a time to reframe approaches to immunization in adults in particular, it would seem that on the heels of a pandemic, which has been almost uniquely devastating in older adults and long-term care settings, this would be the time to seize an opportunity to have a bit of a frame shift in how we approach immunization policies and advice generation, decision making, and then implementation. Like all of the sort of full spectrum of the immunization programs needs to have a renewed focus in older adult health, certainly. I think some of the observations that were made about the composition of NITAGs are interesting. I mean, I can speak from the Canadian experience. There has long been inclusion of adult infectious disease expertise in the committee, and also geriatrics in recent years. That's been incredibly useful, I think, for NACI in the approach to things like influenza, pneumococcal, recently COVID-19, of course, and of course we can't forget Mpox as well, with Imvamune and other vaccine strategies which are clearly targeted dominantly towards adults. In the last few years, we've seen a clear global focus and emphasis on adult immunization that hopefully will help shift thinking. I think one challenge, when just speaking from a NITAG perspective, when you look at the composition of NITAG membership, the the committee is ultimately a formulation of real people who exist in the real world, who have specific training. And so it can be tempting to set a series of conditions or requirements and say we need to have expertise XYZ represented on a committee, but there has to be a supporting pool of experts within the country to draw from to actually appoint onto the committee. And so I would reflect that, Canada is a relatively small country, but there's quite a small pool of adult infectious disease geriatricians with expertise in immunization who can actually fill that function. So, I think we're fortunate that we do have a pool of experts to draw from, but it's not infinite. And I do wonder whether some countries, what would be the actual clinical pool to draw from to appoint into those expert positions, because I know in our experience, it's not the easiest thing to recruit for and to bring that expertise on board, which doesn't mean that it shouldn't be done and it's not an important priority, of course. But I think that would be one perspective to enter into the discussion. I think NITAG membership or policies governing NITAGs is a good starting place, and it's a way to signal importance and interest. But we have to also look at what are the training pathways and the kind of development programs that exist to help bring forward this sort of clinical domain and research domains and expertise on adult immunization, geriatrician, the intersections there, because my experience is that that's a smaller area of expertise. It's kind of niche, and hopefully it's growing, but I think that we have work to do probably as a global community, a research community, to augment that and facilitate research and training and development so that there are robust pools of experts that can actually sit on NITAGs if policies are implemented, towards membership. So that's one thing I would share. And then, with respect to the comments about engagement of civil society and participation in NITAG processes, it's a really interesting and important one. I know that we discuss quite actively about stakeholder engagement policies and practices and how can we onboard perspectives. I think many NITAGs, I don't know if this was captured in the scan, but many NITAGs would have liaison membership from health professional associations or other organizations that are not necessarily core voting members, but do participate in discussions and discourse. And that those are ways that the NITAGs can reach into different clinical practice areas and different patient perspective areas and draw forward those perspectives. So that certainly is, is a way we work in Canada, and I think other NITAGs work that way as well. But I would say, the pandemic's been an interesting exercise in guideline development methods and rapid development methods. And part of the challenge with stakeholder engagement is that it takes time to do it right and to do it well. And in the case of something like COVID, with these evolving guidelines every 2 to 4 weeks in many countries, it's you barely have time to write the things down and get them published, let alone follow robust kinds of consultative approaches. So I think that there's a tension there. Hopefully as we resume more normalized development processes, and maybe there's a year or more to spend some time, do cost effectiveness, do these robust analyses, and have engagement methods in place, it's not always going to be possible. And I think the faster and more urgent things are, then it becomes increasingly difficult to have more robust engagement exercises, which I think gets back to some of your original findings. If it's not going to be possible to always engage proactively with civil organizations, then having some embedded membership and expertise is a good starting place, because then, at least at a minimum, some of those perspectives will be brought to bear. So anyways, those are some reflections on the report findings, but I think there's a great opportunity here. I am hoping that globally, this is a bit of an inflection point in the clear need and emphasis on adult immunization, and particularly older adults. And when we look at the pipeline, we've got RSV vaccines coming, right? And that's another clear area of emphasis for older adults. So I think we're heading into a period where there can be some rethinking about emphasis of immunization programs. So I'm optimistic about it. Anyway, sorry, those are my comments.
No, thank you so much. Yes, I see your hand, Dr. Moore, because there's quite a few points to pick up on, I think, in what you've just said. But yes, Dr. Moore, I want to go to you for kind of comment or response.
Just very, very quickly, you know, if there's a challenge like that in Canada, imagine how much harder it is in New Zealand with 5 million people, and then go to the Pacific Islands that are small countries and some of the challenges that they face as well. And that leads on to one of the questions. The first question was there, what role do NITAGs have in assisting lower socioeconomic groups and so forth? And for me, that is an important challenge. It's more a government challenge than a NITAG challenge, actually, but nevertheless, it's something that has to be taken into account, subject to the capacity of the government, the capacity of the NITAG, and the big question is, how do we improve that kind of capacity?
Dr. Moore, just picking up, do you have thoughts on how to improve it? Do you have any things that come at the top of your head on, you know, if this is a government challenge and it really starts there, what do you think are some of the key things?
I did mention persistence earlier as a fundamental in terms of advocacy work, and of course making sure that you get in early enough to influence governments in terms of their budget, that you're building the relationship with with not just the health ministers and Ministry of Health, but you're also seeking to make sure that Treasury officials understand. And as Matthew said, there's never been a better time. It's been really, really clear that the COVID pandemic has had such a significant economic impact that it is something that governments and treasuries will think about and take into account. How do we effectively avoid that situation again? And that is actually not just about immunisation, specifically about adult immunisation, and how do we prevent the next pandemic? Because one of our big challenges always in public health and prevention is selling the good stories. Oh, the reason we don't have so much disease is because we've done really effective prevention, and that's why we need more money. Well, you don't need more money because you don't have a problem. You know, it is always a really significant challenge.
Yeah, thank you, Dr. Moore. So I want to maybe just ask Miss Louise Hanoff, because I see you've kind of made some comments in the chat. So I'm wondering if you would like to kind of unmute and speak to some of those comments in response.
Sure, I did not expect to.
Sorry to put you on the spot, but I see I wanted to allow you the opportunity to voice your comments.
Yeah, that's fine. So I just wanted to echo some of the things that were said. Indeed, so we are really encouraging and advocating NITAGs to have in their among their members not only experts in adult vaccinations, but also social scientists, and to address the new challenges that NITAGs are facing. But as Matthew mentioned, and I want to echo that, sometimes the expertise in countries is limited, and there are not so many experts that you can put on the NITAG. So and if Matthew says that about Canada, then again, imagine for small countries or countries where the expertise is limited. And the second thing is regarding NITAGs and their remit, and the idea that yes, when GVAP started and the whole advocacy around NITAG started, the GRF indicators were developed. It was really clearly stated that among the experts, pediatricians should be included, and that led into thinking that NITAG's remit was really around children vaccination, and that became an issue when COVID-19 came up, and that was really the burden of disease was really high for older adults. And so some countries faced the issue that the MOH did not feel that the NITAGs would be the appropriate committee to address that, to address COVID-19 vaccination, because it need not, it was not children vaccination. And so that led to having new committees being set up, and the NITAGs would have made the recommendations on COVID-19 vaccination, but the MOH did not listen to them because it was not children vaccination. So again, echoing what you're all saying, we need more advocacy on making sure that the scope of work of NITAGs is really understood and that it does cover a life course approach. Thanks.
Yeah, thank you so much. And I think that's some important context. Dr. Tunis, did you want to make a comment?
Well, just to add an anecdote to Louise's comments there. I mean, we certainly faced that in Canada, actually, with NACI, which is ironic because as you've outlined, NACI is maybe one of the few NITAGs that has some of the strongest inclusion of adult expertise explicitly, by design, and even within Canada, there was definitely some discussion about whether the NITAG would be essentially able to handle the task of COVID-19 vaccine and adult immunization, which I mean, and you only have to look at the guidance from NACI at it's seasonal influenza, pneumococcal disease. Like, we have many adult programs for which NACI and many NITAGs have provided very appropriate, successful guidance in the past. But there was this interesting perception that that NITAGs are pediatric constructs. So yeah, I would challenge that a bit. I mean, the Canadian experience is maybe, I can't speak for every NITAG, but I know that there's a perception out there that NITAGs are pediatric only institutes. But when you look at the suite of recent immunizations, especially in the last decade, there are many adult focused programs that NITAGs have been providing guidance on.
Mm-hmm. Yeah, and I hope especially with COVID-19 that is changing, because that seems silly to not include that a life course approach. But this is, again, the reason that we're here today, is to ensure that NITAGs are not just seen as pediatric focus groups. So there's a few questions in the chat that I do want to get to before we run out of time. But I do want to ask Dr. Sultan if you have any perspectives that you can share, especially in the African region.
Yeah, thank you, Charlotte. I just wanted to point out a few things. The number one is that for specifically for Africa and East Mediterranean and the Arab countries, where the situation is quite volatile in several areas. You look at in Central Africa and Western Africa with many conflicts, and Northern Africa as well. So in these countries, there is a circulation of and misinterpretation of vaccination. I just take the example when I was in Chad, where it was intended to reduce the women fertility, etc. So and this type of feelings have been existing also in Tanzania back then in 2006, 2009 during the measles and rubella vaccination. So I see the same thing that is circulating in Arab countries, where especially the countries in high conflict like Sudan. You take Chad, but you see even if you go to Yemen, etc. So I think in these setups where the situation is constrained and volatile, there is a very need of a very strong advocacy, and not only the usual ways that are used in to convey the messages in a fire brigade, because in my point of view, over 20 years I have been observing immunization programs. Number one, we don't have enough expertise in Africa in adult immunization. Likewise in the Arab countries. So this needs we need, but unfortunately, leave alone the problem of immunization programs. They were not used to deliver adult vaccinations, but in these countries, in Arab countries and the African countries, the status of the woman's status, the decision to vaccinate comes from the man, because the head of the family is the one who decides to empower the woman to take the child to vaccination, and even the adolescent girl. So I believe in this setup, we need to look at more community research-based perceptions that are very poorly addressed by the programs of immunization and even by the NITAG. And the problem becomes very complicated for NITAG because the budget of NITAG depends from the Ministry of Health. So the NITAGs, they don't have the maneuvers to eventually to expand some of the priorities, the research questions, and because if the Ministry of Health and the EPI, they don't see these misperceptions as a problem, if they don't put in the budget, definitely the NITAG will not have enough funds to address them. And I think that's where we need to work a little bit more in order to bring up the interest. We have to empower men to understand that they have to empower their women and their adolescent girls and to take the right decision for their children's vaccination. There is an American NGO that is working like in something like that. It is called Girl Effect. They did very recently with the support of Gavi. They did a study and which has demonstrated widely in Tanzania that if we don't involve men using the existing village frameworks of community involvement, we cannot even not only improve adult immunization, but we may not even sustain the current global and country targets of immunization. Thank you.
Yeah, thanks, Dr. Sultan. I think that's a nice lead in. I see Dr. Moore has made a comment about the need to engage with community groups and leaders, and I think that's a nice lead in into talking about civil society. And there's also a question from Marta Lamazi about how can civil society help, especially around advocacy, and is there a mechanism in place with the NITAGs to facilitate this kind of collaboration? So Dr. Moore, maybe I'll go to you first and then to Dr. Tunis just on how civil society can be engaged.
Well, I mentioned earlier about influencing government, but of course, part of influencing government is also to broadly influence community. And I think the first part is to not try and do it by yourself. You line up with other organisations, and if you are a personal advocate, then find an organisation, whether it's a medical association or a college of general practice or a public health association, a federation for aging. There's a whole range of groups that actually work on public health, and getting a coordinated approach from those to government, to the NITAG itself, will have a significant amount of influence. Because remember, if the NITAG is asking government the same thing as is being asked by civil society and broadly, then government's going to be much, much more receptive to that. And whereas when you are a health minister, as I was, and one person's coming to you saying one thing and another group saying another thing, it's easier to put that off unless you're really determined on a specific issue. So I think, and remember that most of the decision makers as ministers are not subject area experts, and so it's really important that they are getting sound advice from their bureaucracy, from the community, and from the NITAG. And so that means that advocacy has to occur across that range. And don't forget the influence of media, whether it be traditional media or social media. Once you have a community on side of the need for a greater focus on adult vaccination or vaccination across the life course, then the more effective. So that's, in my mind, at the national level. But I did also mention that about the World Health Assembly. I think this is an opportunity for community service organisations also to coordinate. They are, in as far as they've got time to do it, because remember, the vast majority are doing this wide range of different issues. But I think this is a priority one that does need to be raised at the World Health Assembly and then driven into from the top down as well as from the bottom up. That's really what I'm trying to say.
Yeah, that's a great point. Thank you, Dr. Moore. And Dr. Tunis, from a kind of NITAG perspective, do you have are there any opportunities to engage civil society, or where can that be improved?
Well, I would really echo what Dr. Moore just said. I think that as I mentioned before, many NITAGs have standing established linkages and liaison relationships with public health organizations, public health associations, other professional practice organizations. So, that's the most established, well-tread path to influencing perspectives and and also empowering NITAGs to understand the needs, the population needs, the patient needs. So I would completely agree that alignment with established organizations is going to be the most successful. And I think those organizations are generally are looking to have a better understanding and a better grasp of what are the population needs. So I think there are some established channels that individuals or organizations can align with to try and partner with those established groups that already have inroads and linkages with NITAGs and with governments. I completely agree. I think that those are really salient comments. I would also add that as we move forward, the methodologies around engagement are evolving with guideline development. So we may actually see different types of engagement being sought. So I do think there will be opportunities in the coming years where NITAGs may be taking more consultative approaches when time allows to actually reach out more proactively to organizations. And I know that, like, again, citing MPOX as a really recent example, I know that in Canada, in many other countries as well, there was strong partnership between NITAG and government and community representatives, because in the case of MPOX in some countries, the outbreaks were very focused in certain communities, and there was really strong partnership and linkages in order to make those programs successful. So I think there are examples where NITAGs and governments are reaching out proactively, and then there are those established relationships, as mentioned. So there are a few different channels to work through. And the last comment I'll add, and I don't have a great solution for how to achieve this as like an individual and society necessarily, but we're talking a lot about the decision-making tranche here of NITAGs and governments, like governments usually taking ultimately the policy decision, but NITAGs providing advice to a government. But NITAGs are evidence-based organizations. So a key way to influence the spectrum of decision-making is through evidence, right? So where research can be focused on identifying gaps in adult coverage in immunization or highlighting adult disease rates. There are certain diseases for which historically we've had very poor surveillance in adults, like RSV is a great example, right? So respiratory syncytial virus, we know we have vaccines in the pipeline, and globally, I think everyone is challenged to really ascertain how big of a public health problem is this, because the surveillance hasn't been there. So that maybe that's a harder problem to solve, certainly from an advocacy perspective. But I think it's important that we don't overlook that upstream effect, like advocating not only for the decision-making levels, but at the research level. So advocating for better research in adults, in adult immunization, in adult infectious disease, because if the evidence is there, I can guarantee you the NITAGs will use it. They will look at that evidence and they will use it to inform decision-making. So I think that that's another thing to consider, but the pathways to influence research agendas from civil society are more challenging, and I don't have great solutions, but I would advocate to also consider the upstream effects of trying to influence the evidence base. Thanks.
Yeah, thank you so much again. Yeah, there's, I think, lots of points to pick up on. And I do want to come to, I know we have kind of a final few minutes here for final recommendations and for the panelists to each kind of propose a final statement of recommendation based on, you know, their fields of work and organizations. But thank you so much. I think there's lots to pick up on. I'm feeling like there's so much more to discuss. But I think it just goes to show that there's lots of points of advocacy, and that there's kind of some other patient organizations and civil society organizations that can continue to be involved in that, particularly in the sphere of older adults. So I want to just use the final minutes for just final, very kind of brief statement of recommendation. So Dr. Moore, maybe I'll start with you.
Look, I think that the most important part is, as Matthew put it, is the evidence, and using evidence to influence. But don't forget the importance also of an anecdote that illustrates that evidence. So the advocate that goes to a minister to talk about a new drug on cancer and puts all the evidence there will have some influence. But when you've got the baby with you who has cancer, it is just so much more forceful, and I think that's a important part to remember in our advocacy work. I think the World Health Organization is fundamental to this, and it's been really great to have Louise here explaining how they operate. And making sure that community service organisations, as Jane pointed out, well beyond public health, also are able to assist the World Health Organization, because that way we have that pincer movement from bureaucracy to government and back and forth at an international level as well as at a national level. So for me, that advocacy work is absolutely critical. But the second part, of course, is making sure that not only governments but community understand the growing importance of life course immunisation. It's so important, but we really haven't solved that well. Just talking to a neighbour this morning, talking about immunisation, when she asked me what did I do, and she immediately talked about her baby when I talked about immunisation, and when I raised the issue of life course, I said, I hadn't thought of that. And this is somebody doing a PhD. So it's we do have to get that message through, and there's a big challenge, and that's in developed countries. And multiply, as Dr. Sultan was saying, we basically need to multiply those problems manyfold for near me, the Pacific nations, and the small and low middle income countries.
Mm-hmm. Yeah, Dr. Sultan, do you just one final kind of statement of recommendation?
Yeah, I think there is a framework that is not always utilized by immunization programs, and that's basically by principle they are supposed to conduct advocacy to multiply communication with the communities before even all the campaigns of immunization. We have seen it for the COVID-19, for the yellow fever, and even the cervical cancer prevention with HPV vaccine. So what I'm trying to say is that we need very much to come back to the essence. The global polio, the wild polio virus eradication, it came from strong community advocacy. We did it in West Africa and Central Africa, and we did it in so many Arab countries. I believe there are frameworks that are existing, and these are village-based approach, and as well as a faith-based organizations. They have a greater influence. I have seen this in Africa. I have seen across Africa. I've seen it across the Pacific Island and in the Indian Ocean. Unfortunately, the faith-based organizations and at the village level are most of the time, although virtually we are supposed to involve them during micro planning, but we are currently, because of the the outbreaks, we sometimes we leave alone. We don't go back to them because they are the ones who can tell us. So the framework of polio eradication was compacting epidemiology, surveillance, and verification with the community misperceptions about the vaccination. So, and this is what needs to be done. We need now to come up with epidemiologists who and with a community background, with community approaches of communication. So the current approaches in terms of the NITAG, I think the NITAG also need to work very much with the village-based and the faith-based organizations in order to address these rumors and the vaccine hesitancy in the very grassroots. Unfortunately, you see it only using the radio and the television. It will only cover the people in the urban areas, and it will leave alone the people in the rural areas. Thank you.
Yeah, thank you, Dr. Sultan. And Dr. Tunis, just final recommendation.
Well, I think you've covered a lot of ground in this this session today. Yeah, I do think it's important that countries do start using a life course immunization construct and framework. And yeah, and I think, you know, NITAGs are one way to start down that path. As I mentioned, I also think research upstream is critically important. So I would encourage augmentation of research efforts in adult immunization and adult infectious disease to help prop up future decision making. Thanks.
Yeah, thank you so much. So I have to thank Dr. Tunis, Dr. Moore, Dr. Sultan, as well as Ms. Louise Henoff as well for jumping in there. And thank you so much for participating in the panel discussion today. And I'm going to hand it back to Sharon for some final closing remarks as we come to the end of our discussion.
Thank you, Katrina, and a special thank you again to our panelists and Ms. Henoff for sharing their wealth of knowledge in advancing the findings of the Evidence to Action, a review of NITAG's technical report. A special thank you to Sanofi for supporting this project and event with an unrestricted education grant. We will take back the discussions from today to develop a statement of purpose that will be launched on IFA's Vaccines for Life webpage, along with the full technical report. Finally, I would like to share that the IFA will be hosting the 16th Global Conference on Aging, which is entitled To Challenge, Transformation, and Change, and it will be held on June 27th to June 30th in Thailand. Immunization for all ages is a key theme during the conference, along with older women, digital technologies, age-friendly environments, and maintaining and improving functions. So we do encourage you all to register and submit abstracts, and for more information to access our website, which will be featured in the chat function, and we look forward to seeing you there. Thank you everyone again for your participation today, and wishing everyone a great rest of the day. We will be in touch. Goodbye.